Welcome. This is our health channel. I'm Dr. Justin Lin. We're shooting here in my clinic at Rehab and Biophysical Therapy in Tustin, California. Our health channel is created for us by one of us. Not too long ago was I where you're at, wondering all these different health questions, how to sift through about wellness, fitness, and injuries. All the information out there, how do you really understand what the true source is, and does it even make sense? So sit back, relax, and learn. Because after all, this is our health. In just a few moments, we'll be inviting our guest, Dr. Jekwon. He's an oncologist over at the Cancer Center of Irvine here in Sand Canyon. He's a graduate of my alma mater, Boston University Medical, and he'll be here to discuss some of the latest topics about HPV and its relationship to cancer. This is a hot topic, and it's growing and it's trending, but you know, it's a sexually transmitted disease and it's getting spread worldwide and through many sources. So stay tuned and find out how it's going and why it's affecting people and some of the interesting things about throat cancer and HPV. So stay tuned. We have our guest here, Dr. Ye of the Cancer Center of Irvine. Thank you for being our guest here today.
Yeah, thank you for having me, Dr. Lin.
Great. So you're here to discuss with us cancer, HPV, throat cancer, some of the latest topics. Really fascinating stuff.
Yeah, so today I'll be talking about HPV, or human papillomavirus, and its association with different types of cancer, especially head and neck cancers that originate from the oropharynx. The oropharynx is the back of the throat. Structures include the tonsils, the soft palate, base of tongue, and also that posterior pharyngeal wall. Basically, it's a space right behind the mouth.
So why is this like the latest buzz right now? Why throat cancer? I mean, what's going on?
Yeah, so what we've seen is, you know, traditionally throat cancer was a disease only in older men in their 60s, 70s, and above. These were smokers and drinkers, patients with, poor hygiene that are developing type of cancers. But now more and more we're seeing younger patients diagnosed with this type of cancer in their 20s, but most patients are between the 30s and 50s, and it is associated with the human papillomavirus. And this is the same virus that causes cervical cancer, anal cancer, vulvar cancer. So now we're seeing its association in head and neck cancer also.
Well, that's real fascinating. I mean, how could, for the public, you know, how's it spread other than, you know, it sounds like, you know, it's a sexually transmitted disease, isn't it?
Yeah, so it's transmitted by any type of sexual contact or exchange of bodily fluids. There's some thought that kissing, oral sex, and regular intercourse can cause the transmission of the HPV virus.
Really? Kissing? Just kissing your general girlfriend or something like that?
Yeah, anything that can transmit bodily fluids can potentially transmit the HPV virus.
How does that happen? Is it through contact?
Yeah, so a study done at Johns Hopkins showed that HPV strain 16 was highly associated with the development of oropharyngeal cancer. They also found that patients who had many oral sex partners, greater than 6 or more than 26 vaginal sex partners, were at higher risk of developing HPV-associated throat cancer.
Wow, that's some interesting numbers and some, you know, great facts for everyone. Now, how common is it for the public to know? How common is throat cancer? I know you said, you know, previously it was thought by, you know, the 30s and 50s, but now it's a little bit younger. So, I mean.
Yeah, so on average in the U.S. there's about 12,000 cases of throat cancer. About 2/3 of those are associated with the HPV virus, so a good majority of them. And we find that about 80% of them are in men and 20% are in women.
So what are the signs and how do you screen for it? I mean, how do you look for this, something that's happening and you want to be, screened properly, correct?
Yeah, so there's currently no proper screening exam, but most of the symptoms that patients present with are difficulty swallowing, pain with swallowing. Oftentimes patients can have weight loss because they can't eat as well. In its later stages, the cancer actually can spread from the throat to the neck area in the lymph nodes. So the lymph nodes can be swollen in the later stages. So as a provider, if a patient complains of a sore throat, you would look inside and you could see a mass in the throat. Sometimes it can be bleeding. Sometimes you can actually see the actual tumor, and it's involving the soft palate and the tonsils. And like I said, they can also have swelling in the neck.
Now, are they doing like for women, they do pap smear. Is there something similar for men, like a pap smear for our mouth or something?
Yeah, so currently they're doing some research into doing swabs of the throat to look for any suspicious cells, much like a pap smear, but all that is under research right now, and nothing is formally recommended for throat cancer.
What do you think can be done? Just a hypothetical.
So there is a vaccine for women to protect them against cervical cancer. And so there's some thought that that vaccine may prevent throat cancer from forming too. But these are just theories, and they haven't been proven yet.
I mean, are there ways to prevent this? I mean, I know they tell you about condoms and protective sex, and just you saying kissing kind of alarms me. Yeah.
So I mean, condoms are always a good idea. But there is always still some transmission of bodily fluids. So I would say that there's not much in terms of preventing this cancer from forming, except possibly getting the vaccine.
So, if let's say you have it and you develop this, what are some methods? What can be done? Well, I mean, so you have it, and it's in stage 1 or 2 or 3. And for the public, this is just stages for cancer that they're spread. And I think Dr. Ye can go a little bit more further in it, but what can be done?
Yeah, so cancer is staged from stage 1, 2, 3, and 4. Of course, 4 is the worst. 4 means that there's been distant spread. Most often it's to the lungs. If it has spread to the lungs, the disease is considered not curable, and the treatment for that would just be palliative chemotherapy. Once the disease has gone into the bloodstream, you need a systemic treatment, so chemotherapy would be the appropriate treatment of choice. But if it's stage 1 to 3, it's generally treated with radiation. In the later stages, more advanced stages, sometimes we add chemotherapy to accentuate the radiation to get a better chance of cure. When we do the radiation, we target the tumor, and we also target the lymph nodes in the neck, and we try to go in and sterilize the areas of cancer cells.
So what about the earlier stages? Is there any other ways to kind of take care of it?
At early stages, I would say if it's very localized and it's just a small stage 1 tumor, sometimes they can do surgery. They can remove the tonsil. But most of the time, patients are diagnosed much later in the stage of their disease. Oftentimes, they complain to their general practitioner that they have a sore throat. They're given antibiotics. Sore throat doesn't go away. They look inside, there's still a mass there. So if ever there's a sore throat that does not respond to antibiotics, there should be a suspicion of a possible throat cancer.
So could this be transmitted? Now I treat patients, and I'm talking to them, and sometimes I work on their neck, and then they cough on me. Do you think I can get that?
No, it's probably very low. It probably needs direct contact of the fluids with your body, so I think the chance of that happening is very low.
Okay. And so, I know you told me about cervical cancer. Are there other places that I guess the HPV can cause other cancers?
Yeah, so
it's very fascinating. This is new to me.
Yeah, so the HPV vaccine, it can cause anal cancer, and that's more common in patients who have anal receptive sex. Also cervical cancer, as I mentioned before. Also vulvar cancer, vaginal cancer. Some forms of penile cancer are also associated with HPV virus.
So just a final question, I think, for the public, a little bit more about, why is cancer just so on the rise here in the U.S.? What, just in general, I'd love to get your idea.
Yeah, so most of the time when patients develop HPV-induced throat cancer, they've been infected by the virus for almost 15 years. in most developed countries, humans are much more promiscuous than we were in previous years in the 50s. So that's contributed to the spread of the disease. Also, most patients with the virus, they're asymptomatic, so they go around infecting other people and without knowing. Most people, we actually do carry the HPV virus, but only some of us actually develop the cancers. Most of our immune systems are strong enough that we can avoid the cancers from developing. What happens is the virus actually integrates its own DNA into your normal cell's DNA, okay, which causes cancer. So, right now we're seeing, cancer develop based on our activities from 15 years ago.
Oh, that's very fascinating. So once again, everyone, this is Dr. Ye. He's over at the Cancer Center of Irvine. You can go and visit if you have any questions or concerns, and then schedule something with him. It's great having you as a guest here at the hot seat. Thanks for coming.
Yeah, thanks for having me, Doc.
Come back again.
All right, thanks.